All right, so welcome back to Better Health's coverage here live at HIMSS 10. I'm Mike Zavella here, and we have Robert Quinn from Epocrates, Senior Vice President of Engineering and Chief Technical Officer. Ooh, the tech guy. You're the tech guy. So in case that people don't know what Epocrates is, and I don't know why people wouldn't know what Epocrates is, what is it?
Well, Epocrates has been around for 10 years, and we are a leading provider of medical reference tools for handheld devices like PDAs and smartphones, but also for the web. And we have over 1 in 3 physicians domestically as an active user of one or more of our products.
Great, yeah, and I'm familiar with the product. I use the product. You're on a bunch of mobile platforms. A question I know we're going to get is, as far as new platforms.
I'm sorry, we've just shipped on Android and on WebOS from Palm. And that goes with current or legacy Palm OS, if you would, as well as Windows Mobile smartphone, as well as RIM, BlackBerry, and of course iPhone.
Great, great, and of course, some of the features are looking up medications and also looking for drug interactions, that sort of thing.
Right. So we have a drug guide, which is our flagship product, and of course interactions, contraindications, cautions, dosing, and so forth, as well as picture. You can do identify a pill picture. If somebody brings in some pills, they don't know what they're taking. The physician can basically profile the pill and come up with a picture and identify the pill. We also have a premium product that includes not just the drug guide, but also a disease reference with content that we've produced together with British Medical Journal. We have a symptom checker, we have a laboratory test interpretation guide, and a whole slew of other tools.
Oh, great, great. So I know that you have some desktop applications too. Can you tell us a little bit about that?
So we have much of our content available via the large screen browser, most of it for free online. So our disease information, our drug information, the pill identifier, many of the things I've described, also available at via the Epocrates site. Just need to register and start using.
Great, great. And I know I use a Mac, and we have a lot of fans that use the Mac. Is that some of those software solutions don't really convert over to Mac at this point, or?
Well, so we support. We support mobile devices natively. That is to say, with applications on device, storing data persistently on device, and useful even without a signal. On the web, though, with a desktop system, we are entirely browser based, assuming that most people on a desktop have an internet connection. So we'll work on on Safari just as well as we do on other browsers. So Firefox, Safari, Internet Explorer, Chrome. So sure, we have lots and lots of users on Macs as well.
Oh, great, great. Do we have we have a lot of questions, probably, I would think. All right, let's go.
All right. So our first question is from HRANA. When will you support Nokia's Symbian? Epocrates has been talking about supporting it for years.
Well, Symbian, we have a lot of respect for the OS. What we're looking for is a level of traction domestically that would cause us to invest in a port to that platform. So I don't have a specific date for you, but we are watching the market very carefully. If and when we decide to move to non-domestic locations, certainly Europe. It would be something that we would really accelerate. And something I also wanted to mention with regard to the company is we've announced today that we're moving to electronic medical record solution, which we're going to be shipping in the fall on both mobile device, native on the iPhone, as well as a web interface, targeted at small clinics, 5 and fewer physicians. So that's something we're extremely excited about. It's something that will be it will take advantage of all the content that I mentioned before on device as well as on the web, and it will exploit our expertise on how to use the mobile device with optimal efficiency. So for example, if you have a signal, it'll use it. If you don't, your patient information will all be on your device so that you can use it in a lead-lined rad lab or deep in the bowels of a hospital.
Oh, wow. Well, I'm a family doc in Ohio and in a small practice, so I guess you're aiming right at my market there. So So how would that work then, specifically with this product?
So this is an app that you will be able to use on the web if you don't have an AT&T account or an iPhone. But if you do, you'll be able to go to the App Store. You'll be able to get the application, install it. It will work together with web. We're targeting small clinics and small clinic workflow, so that you should be able to get up and running on our application fairly easily. It's going to be affordable. It's going to be accessible from anywhere via mobile iPhone as well as the web, and it's something we're extremely excited about.
So what kind of information would it be with this?
It's going to be an electronic health record system. So this is a system that not only will have the drug information that we've got in the hands of 275,000 physicians domestically, but it also will be a complete solution for recording patient information at point of care, for electronic order entry, for example, electronic prescription as well as electronic lab, as well as integration with a partner for calendaring as well as billing.
So you interface with the Office kind of EMR system? How does that work?
No, we will be an Office EMR system.
So it's a standalone product.
It is a standalone product. We will be partnering with a practice management system for high-end calendaring as well as billing interface. So we'll have tight integration with a partner for those pieces. But in terms of the clinical data, the electronic health records themselves and all the orders surrounding that, it will be an Epocrates developed solution, standalone product.
Oh, really? That's fascinating. So how is this different than the other? What is out there? As far as a big big pool of other EMR products.
It is targeted at the small clinic. We feel we understand the physicians in that environment very well. Many physicians over the years have been saying to us, hey, I'm in the drug monograph looking at the dosage right now. Why can't I just push a button and do a script? And so now they will be able to do that. And in addition to that, we feel that our mobile expertise gives us a leg up in capitalizing and exploiting that platform better than others. So, for example, whereas many EMR mobile front ends require a signal and they're basically browser apps on the device, our application will be resident on device. Patient information will be stored encrypted securely on device, so that if you do not have an internet connection, you will still work. You'll still have your patient information there. And when you do have a signal, we'll use that very intelligently in the background to sync information back and forth. So we want to apply 10 years of expertise in mobile development to this product, and we feel that value will be shown at the point of care.
So a lot of questions that come up as far as privacy. How do you answer the privacy questionnaire?
A great deal of time on issues related to privacy and security of the data. We have a high-end security firm that is doing design reviews, code reviews, penetration testing, and so forth and so on. This will be a software as a service model, which is affordable for the clinic. There won't be the need for in-house computers, data sets, and so forth that themselves call questions up with regard to security. So small clinic physicians will not have to worry about that. But yes, we're spending a huge amount of time on security as well as performance capacity and scalability concerns and robustness concerns with regard to our back end.
So that that patient information, is that on site at the doctor's office? It's web-based thing.
Well, it is web-based, but it is also on their mobile devices. So it will be on a touch, on an iPhone. Our target is to ship on the iPad. Before long, well, I shouldn't say before long. We're targeting the fall for shipment of this product, and our target is to try to have the iPad either on release date or soon thereafter.
Great. I'm sure there's probably a lot of other questions in there going on.
I
I'm sorry. I'm sorry. I'm like, oh, it's not about me.